Welcome to Healthy Wealthy. Today's topic is about a common heart disease called atrial fibrillation or shortly AFib. We invite three guests today. First is Mr. Nan, who experienced atrial fibrillation. And next are Dr. Jia and Dr. Keng, cardiologists from Maharaj Hospital. Good morning, all of you guys. And Dr. Jia, could you tell us a little bit about atrial fibrillation?
Yes. Atrial fibrillation is a very interesting disease and everyone should pay attention to it because it is the most common arrhythmia, which means abnormal heart rhythm or heartbeat.
Could you give me more details about it?
Okay, normally the heart can generate impulse from a group of cells called SA node only, but in atrial fibrillation patients, there are other parts of upper chamber that can generate impulse faster and more irregularly, lead to fast and irregular heartbeat.
I see. Now we briefly know about atrial fibrillation. Let's move to another important guest. Mr. Nan, please introduce yourself.
Hello, I am 70 years old, retired football coach who develops atrial fibrillation from time to time. I will share my story today.
So what are symptoms you usually have?
During an atrial fibrillation episode, I feel my heart beating and it was fast. I also had chest pain. Sometimes I feel dizzy and fatigued. These symptoms get worsened over time, so I went to the hospital and the doctor told me that I must have atrial fibrillation.
Also, there are other symptoms including reduced ability to exercise, shortness of breath, and weakness.
These symptoms can also be found in many heart disease, but if you want to surely give a diagnosis of atrial fibrillation, you need an electrocardiograph measured from the patient.
In the picture, show the difference between normal ECG and ECG of atrial fibrillation. In atrial fibrillation, you will see small wavy waves and irregular rhythm.
Okay, but by the way, does this heart condition affect your lifestyle?
Yes, of course. I can't play football at high pace anymore. Climbing stairs is difficult for me because of my symptoms. So I moved my bedroom downstairs and just live on the ground for now.
So it's like adjusting your lifestyle to lower the risk of having symptoms, isn't it?
Yes.
Okay, and do you take any medications recently?
I have taken bisoprolol and warfarin.
Bisoprolol is also known as beta blocker. It helps reduce your heart rate so that you will feel better with your palpitation. And warfarin is an anticoagulant, which means a drug that helps prevent blood clot. It also helps prevent stroke, which is one of the dangerous complications of atrial fibrillation.
Doctor, if I don't want to experience atrial fibrillation, what should I do?
You should avoid the risk factor of atrial fibrillation such as smoking or drinking alcohol. And you might exercise regularly for preventing diabetes and obesity, which is one of the risk factors of atrial fibrillation. But you must exercise only according to your limit. Over-exercise may lead to more atrial fibrillation symptoms.
Today we preserve about causes, symptoms, treatment, and even prevention about atrial fibrillation. And thank you all of you for this useful information. But sadly, it's time to say goodbye. And see you again next week with Healthy Wealthy. Goodbye.